Please welcome back to the show one of our faves, Dr. Peter McCullough. He's the Chief Scientific Officer at the Wellness Company. Dr. McCullough, welcome back to the show. How are you?
Good, thank you.
So what can you tell the viewers about this human observational study?
The Wellness Company about a year ago put together a combination of ivermectin and mebendazole, both anti-infective drugs for the on-label indication of treating neglected parasite infections. But we knew that patients were learning about separately advances in preclinical studies with ivermectin and in preclinical and clinical studies with mebendazole. Patients were learning about this. They were requesting the drug for off-label use, so our doctors approved it once we checked with their medications and the patients checked with their cancer doctors. And then we kept track with baseline demographics and then, what's happened over the first 6 months. And just under 200 patients were enrolled. The leading cancer was prostate in men, breast in women, then lung cancer, then other solid organ cancers. Most patients took 1 tablet a day. Some took 2, even up to 4. They're 25/250 milligram tablets. And we were stunned with the results. The overall net benefit was 84%. A significant amount of patients basically held the same. They didn't have any new cancer metastases. We had about 16% where the tumor actually regressed. Things improved. They're getting scans, of course, and rescreening every 3 months. About 25% had side effects, most commonly GI. But this is the first larger human patient-reported outcome study. Very, very favorable. This should stimulate the National Institutes of Health, National Cancer Institute to do large-scale prospective double-blind randomized trials.
Okay, and I guess that's the key point, because again, let me just hit those numbers again so people understand. 84% of participants in the study reported positive results from the use of the combination, 48% reporting regression or no evidence of cancer, while another 36% reported disease stability and only 15.6% reporting disease progression. So, and as you just said, this hopefully leads to something bigger. How encouraged are you by this? And again, what would you see as the road now forward as far as timing goes? Is this something we see in the next? We all know these things take a long time. What's the time frame in your mind?
Well, I'm certainly very encouraged. Now we're going to continue on, so we'll get 12, 18th, and 24-month data. If we get consent, we can abstract the records, look at all the CAT scans and PET scans, start to really clinically adjudicate what's going on. But this is so good. The drugs are so available. There are so few breakthroughs in cancer. The National Cancer Institute, I think, should really move on this and do a trial of the combination. There are separate kind of advanced breast cancer study with ivermectin. There's some advanced brain cancer studies with mebendazole, small studies. Johns Hopkins has a dose-ranging study of mebendazole. I mean, we've demonstrated safety. These are widely available drugs. We believe the combination assembled is the test article now. I think we just should go. And I think, honestly, out of the box for my patients, I've been using 1 tablet twice a day. I think we ought to go with 1 tablet twice a day and maybe multiples of that upward. And if this can add to conventional surgery, chemotherapy, and radiation, and have patients basically either hold the cancer the same or resolve it, boy, it would be a shame to see this held back.
One of the questions that people should be asking is, and it's great work by you guys, but why is it that you guys had to commission this study, and why is it that, at least from my point of view, you see a lot of talk about this combination on social media? Not that we should be listening to every person who says they're a brilliant doctor on social media, but why is it that it's taken you guys to do this study, and the only talk you see about this, at least as far as I can tell, is on social media? Why aren't the bigger players, and maybe this will make them, why aren't they as interested in you guys have been?
Well, we did post this on the European Commission Zenodo preprint server, so it's in the scientific community. It's actually under peer review at a journal right now. The problem is perverse incentives. So what happens is the cancer centers can do what's called book and bill for chemotherapy. So it's the very expensive chemotherapy. They make a higher, they have a margin, so they make a higher net proceeds when they use the expensive cancer chemotherapy. They're not incented at all to use low-cost, available generics. So one of the things I think Dr. Oz should do in CMS is the cancer centers should be incentivized to actually find these practical solutions and be able to feature them for their patients.
So for people who are interested in trying this combination for whatever the reason, what do you recommend for them?
Well, they should go to twc.health, use your promo code VOICE, get into the system, click on ivermectin-mebendazole, go through the intake survey. You become part of the observation cohort, and then you'll get the medication, provided it's going to meet the profile of the patient, get it sent out to them. Patients always have to disclose this to their hematologist oncologist, who are becoming more accepting of this. For so many patients with cancer right now, they don't want to wait. And sometimes research can take, many, many years before a study is commissioned. Many want to move now, given these positive results.
We're speaking with Dr. Peter McCullough. You can go to twc.health/voice, twc.health/voice. Use promo code VOICE to save 10%. Dr. McCullough, always a pleasure to have you on. Thank you very much.